Okay, we're going to be talking about chapter 24, drug abuse, or really just childbearing family with special needs. This is mainly focusing on drugs and just other situations that aren't optimal for having a child. So first we're going to talk about alcohol. Alcohol, as we know, there is no safe amount. Drinking it while pregnant can lead to fetal alcohol syndrome. So just think, it's not good for the baby. Spontaneous abortion, abruptio placentae, along with a lot of other problems. The amount you drink impacts its effects. So I'm not saying that there's no safe amount, but the more you drink, obviously, the more it's going to have an effect. So when looking at fetal alcohol syndrome, we're going to go over a few things. There are three main parts that characterize it. First one is growth restriction. So they're not growing as both in the womb and after as well as we would like. Next is central nervous system impairment. So again, we're thinking maybe neural tube defects, maybe some type of just brain's not working right, something like that. And we're going to recognize a combination of facial features. So growth restrictions are noted in length, weight, and head circumference. CNS impairment includes intellectual impairment, learning disabilities, high activity level or short attention span, or poor short-term memory. Common facial anomalies associated with FAS include macrocephaly, short palpebral fissures, epicanthal folds, flat mid-faces with low nasal bridges, and a thin upper lip. So if you picture, we all know the picture of the baby that it looks like their face is moved in and they just don't look quite right. One of the people I think of is Greta Thunberg. I don't know if that's true, but just that kind of gives you an idea of what fetal alcohol syndrome will look like. So remember, three parts. Their central nervous system isn't working quite right, their face looks a little bit different, and they don't grow optimally. Next, we're going to look at cocaine. So something that cocaine, meth, and nicotine all have in common is vasoconstriction. So when we look at vasoconstriction in all of them, they're going to have similar effects. So but just think vasoconstriction equals problems. Again, a real big part of having a baby is making sure it gets adequate blood flow. So when that doesn't happen, problems arise. So if we think about it, vasoconstriction is occurring in all of these, we're going to see similar problems. So we're going to see an early birth, maybe low birth weight, a stillbirth, and developmental problems, along with others like, I don't know, just bad formations. It's not gonna develop like we would like because it's not getting the adequate nutrients. And another thing we need to realize is when you're doing cocaine, meth, and possibly smoking, you're going to have compound problems. So the person that's on meth probably isn't working a good job getting their folic acid. So that's something else to consider, is that we're going to see a lot of problems because of the lifestyles that these have. So we may, with like meth and other drugs, we're going to see a higher chance of having like STDs in it and stuff like that. So they may have STDs, HIV, pancreatitis, just stuff like that. So their whole general sense of well-being is going to be lowered. But as far as cocaine, signs and symptoms of someone on cocaine, think fast. Everything's going to be moving really fast. They're going to have hypertension, tachycardia, they're probably sweating, really excitable, just everything's moving fast. So just keep that in mind because this is a stimulant. And these people are also going to be on seizure precautions. Next, we're going to look at meth. Again, vasoconstriction, a stimulant, which occurs from stimulants. We're going to be looking at the same type of problems: early birth, low birth weight, stillbirth, abruptio placentae, and developmental problems, stuff like that. A baby that is born on meth, the baby's usually really easily agitated and it's kind of detached, and it doesn't react naturally as how we would think a baby would react after birth. It's also good to point out methotrexate has serious problems. This is not methamphetamine, it just reminded me. Methotrexate, it works like the opposite of folic acid. It's a treatment for arthritis. I just put it in here because it rhymes with meth. So methotrexate, do not give while pregnant. Nicotine, so again, we're going to try and talk about smoking cessation. Nicotine, same problems as here. Because of this vasoconstriction, we're not getting blood flow and we're seeing these problems. Something else, German measles, also known as rubella. Another problem, can cause low weight, slow growth, and failure to thrive. So if you have German measles as a baby, or your mother does while you're in the womb, or it just affects you, we're just not going to see this baby growing optimally. Just keep that in mind. Last, we're going to look at opioids. So the effects of opioids on a baby. So opioids, first we're thinking are like morphine, heroin, methadone, meperidine, hydromorphone, hydrochloride, stuff like that, oxycodone, so stuff like that. So opioids are depressants, so it makes sense we'd see low growth, SIDS, low weight, again, not optimal growth. And the effects on the mom are malnutrition, anemia, and STIs. So we're looking at STIs, we may be thinking of other things up here. Malnutrition, we know how important nutrition is for the baby, so we can see how that could affect it. And anemia, again, we need that good blood flow, so we can see how that could hurt a baby too. Signs and symptoms of opioid withdrawal, because these are highly addictive, include yawning, sweating, like rhinorrhea, which is just runny nose, and cramps. So keep that in mind. And if you pull someone off of these too fast, it can really hurt them. So make sure we're smart. Methadone is a common drug used to wean people off of opioids. So these are your main drugs that we're going to be seeing. Now also, families may have to deal with domestic violence. So in this case, safety for the mother and her baby are our priority. So if they need to be moved to a secured room or a hidden room, we do that. We're going to make sure that they are safe. We're also going to listen. We need to understand the situation. So if she's reporting, hey, my boyfriend has been really aggressive to me lately, we need to be listening for that. Next, we need to report. If we find signs of abuse, we are mandated reporters. Now, there are certain situations where they either tell us not to report it or we don't have to report it, but keep in mind, like young kids, elderly, if it could be a threat to the baby, we're going to report it. And we need to educate them on resources. So if they're in a bad situation, we need to find a way to help make that situation better for them. Next, we'll talk about infant death and abnormalities. So births don't always go right. So if a baby is born maybe with a severe congenital defect, or it's just stillborn, we're going to make sure we're very respectful, because this is a very hard time in their lives. We're going to allow them to acknowledge this baby. So if they want to take pictures with it, we do our best to get them in a good blanket, dress them how we need to, set up give them access to whatever they need access to. We're going to allow them to acknowledge that this was a person who lived and died, and give them the rights to deal with their feelings. We're also going to provide information, whether this is just giving them counseling or whatever they need, like on teaching them more about what happened. We're there to provide them with information to help them get through this process. Lastly, may not be a big deal in class, we talked about weed. So weed was probably not that big of a deal. Don't worry about it, but if it is, just know that it can be somewhat vasoconstrictive, but we're probably not going to see that on the test. But keep in mind, weed probably has similar effects to nicotine, but again, not a big deal.